So you still have pain here?
Here.
Okay, yeah. Alright. So this is how I would go about treating this. So I'll go round 12. Now I'm going to palpate around 10 and just below more specifically, but palpate the whole area. And it's like there's just little granular bits. If you notice, I was exploring around here just to make sure that that's not the norm.
Takie granulki można wyczuć jakby.
So I'm going to go here. And when it comes down to locating an ashy point or painful point, I'm just going to put that there. I trust the ashy point more than the location. Obviously, it has to be within a small area of where the problem is.
Przy lokalizowaniu punktów ASHI bardziej się polega na ich odczuciu niż na konkretnej lokalizacji. Oczywiście jakby początkowy obszar jest dość mały w okolicach punktu.
Okay. So, as he has problems around trapezius, I'm going to be looking in around kidney 17. Again, it's kind of more important to, if I can isolate an ashy point, and ashy doesn't mean painful in this case, I mean something different, a nodule or just something that feels a little different. So I'm going to do both.
Tutaj ASHI nie chodzi o tkliwy punkt, tylko po prostu o punkt o strukturze wyczuwalnie lekko innej od reszty dookoła.
Ostatni czułem.
Oh, he felt the last one.
As in sting or?
Ukłucie czy co?
Ukłucie i dalej jakby tak szarpie delikatnie.
It was a sting and it still kind of pulls.
Okay. And that's important to know as well. It's the only time I'll remove a needle. Because sometimes you can hit a little sweat pore or a capillary. In this case, it must have been a pore because he didn't bleed. So I take the needle out and desensitize by just rubbing the area.
Jeżeli ktoś ma takie odczucia, to oznacza, że znaczy on wtedy wyjmuje igłę, dlatego że mógł trafić w jakąś malutką żyłkę, czy w gruczoł potowy.
And then I'm going to explore around, actually we need to do REN 9 because he has a herniated disc, and REN 9 to the middle depth is pretty much a universal treatment in this case for the likes of hernia. Okay, and then I'm going to, so we have REN 9 in, stomach 25, actually, yeah. So wants to feel in around here.
Rain?
Just, yeah.
I can see it. Okay.
This is the pericardium channel. So it's more sensitive usually. You can tune your sense in. So I would say just explore there. It's more about what's under the skin.
I feel something over here.
Okay. Yeah. Now sometimes you can also have at the back of your mind, it does have quite a lot of this type of outline of tattoo, that there's possibility that that could be giving you false ashi points, because I'm feeling it here, which is okay. I'm going to needle it as well.
Przy tatuażach często trzeba uważać, dlatego że granica
Just stay
tatuażu
there
może
rather
często
than
przypominać
going like that, because you're getting
punkt ashi.
like hair and stuff.
Yeah, I feel more
So
hairy.
stay in one point, and if you need to move, just move like that rather than going like that, because you're getting hair bristles.
Jeżeli przemieszczacie palec, to nie tak jakbyście przeciągali, dlatego że wtedy zahaczają wam się te włoski i zmieniają odczucie, tylko bardziej przykładając cały czas palec, przekładajcie ciężar na jedną albo na drugą stronę.
It's like sometimes if a person has like a belt buckle that's been sticking into them, then you have to think, is that really an ashi point for lower back, or is it the belt buckle that was there for the last 3 hours?
Trzeba też pamiętać, że na przykład jeżeli przychodzi ktoś, kogo opina mocno pasek i ten pasek ma klamrę i jest czuły punkt, to czy to jest rzeczywiście punkt ashi, czy to bardziej komuś się odcisnęła ta klamra i boli.
So over here it's similar. Is this side as uncomfortable as this side?
Raczej tak.
That side is more...
Yeah. I wouldn't rely in this case too much on the way this tattoo was done. There's heavy ink in different places, so it can give you, I feel, possibly false reading. And I'm going to do spleen 15 because to nourish the muscles and joints, and also because of the nature of his problem, it's long term. So spleen 15 will be good to nourish muscles and joints as well. Okay. So I'm very gentle with how I put the needles to depth.
Bardzo delikatnie ustawię głębokość igieł.
And I'm kind of relying on this gentle sliding technique
I tak przesuwa
to bring
dłoń
me
w
to
ten
the depth.
sposób, żeby dotrzeć na
Yeah.
konkretny poziom.
Czy to jest na poziom mięśni?
Is it the muscle level or?
So
Which
those two would be in the humanity level.
Na środkowym poziomie.
So middle depth. And these will be at the heaven level,
Tu mamy ten poziom nieba.
and because I'm treating the
Wbijamy pionowo.
posterior part of the shoulder, well then I'm going slightly deeper.
You always needle vertically.
Yeah, always needle vertically. As I said, if they fall over when you're finished putting them to depth, that's fine. Needle vertically, there's less area of the needle to pierce the skin, so you're less likely to have uncomfortable needling, but also you're going into the point that you want to go into.
REM 4.
REM 4, yeah, yeah,
the same way.
perpendicular, yeah. Now, on occasion, I'll direct REM 12 and REM 4 towards each other.
Qigong?
Bringing chi.
Drinking qi?
Yeah, but specifically just the heaven, or sorry, yeah, the
Heaven and
heart and kidneys. So, because particularly if somebody's a tendency to do anxiety, you want to direct chi away from the head where they'll be ruminating on all the what if things could happen.
Co do nakłuwania, tak, pionowo, dlatego że jeżeli nie nakłuwasz pod kątem, to mniej igły dotyka mniej skóry, więc jest to mniej bolesne i mniej nieprzyjemne. Dlatego w ten sposób.
Okay, So now I'm going to have you just check in.
Z tyłu.
So where are you feeling it now?
This point.
Okay. Are you having to look harder to find it?
Ciężej ci go było znaleźć?
Tak.
Yep.
Można powiedzieć o 1 punkt jest mniejszy.
W sensie, że się punkt...
Tak, znaczy
Okej.
w sensie, że o 4, dawałem 4 jest ten ból, tak, no to bym teraz 3 dał.
Okay, the pain has
Delikatna
gone
zmiana.
from 4 to 3.
Okay. So that's 25%, not enough. Which is okay. And this is where you often have to refine the level of the needles now, just to see.
W tym momencie musimy poprawić
What about
głębokość
Here.
igieł.
Are we counting till 70?
oh yeah,
Właśnie o tym samym
pop
myślałem.
up, go through.
Better. But
Okay.
50%.
50% better.
Better.
Has it moved?
No.
Okay. So what about pain here?
Maybe a little
Less.
down. Trochę niżej zszedł.
It's a little lower. No.
Okay, so the pain has moved and it's reduced. This is like, sometimes you have to really get it down to exactly what's going on. So, okay. I'm going to go a little bit deeper with this needle before I go using more needles. Because I want to see if I can improve the result with the needles I've used before I start doing the Melbourne trick. Okay, how's that now?
Better. Ale zostało jeszcze.
It's still there.
Ale z 30%.
It's like
coś takiego.
30%. 30%.
30% left or 30% right?
Left.
Okay, so we're 70% improved. We're getting there. We're getting there. I'm going to go a little bit deeper with this. Okay, I'm going to do one more in around 214.
Jeszcze jedną około punktu do 14.
Because sometimes the likes of 2 or 3 needles will reinforce each of the other ones. How's that going on?
Jak teraz?
Tak samo.
It's
To
the
co?
same.
Okay. Oh, sorry. So where is the worst of the pain? Is it here? Or? Oh, yeah. Okay. Do you know, it's even maybe lower than I thought it was.
Yes.
Yeah. Okay. So actually, I'm going to swap this one for this one. Okay. Now, how's that?
Jest okej. Jest okej.
Do that. Okay, so we'll see how you are tomorrow. Now, in this case, so you notice the way I rather than putting in the 70 needles that I could have, I want to utilize these needles as best I can. So realizing that it was actually a little bit lower than I anticipated, I thought it was more here, and it's more here. That's the big difference. So that's why I took one needle out and reinserted it.
Lokalizacyjna różnica, że on myślał,
Lower down.
że ten ból jest wyżej niż był, sprawiła, że właśnie trzeba było jedną igłę wyciągnąć i wbić inną gdzie indziej.
So most of these needles, these are the deepest two. And really,
Te są najgłębiej.
you're okay. Let's go a bit deeper because it's the bone.
Which bone? Spine?
So I'm using
Yeah, the spine.
I'm using REM4 kidneys, bone, marrow.
Yes, in that way,
Just-
okay.
So that's now definitely at the back wall level. This is more in the heaven, or sorry, the humanity level. We're going to go a little bit deeper and see if we can improve this. Now, check that now.
Are you still alive?
So, somebody asked me about
To
depth.
samo.
It's the same.
Okay. Somebody asked me about depth earlier on. Really, when you hit resistance, that's no, it's the peritoneum, the wall, and it's quite solid. So it's okay to go to that depth. Even with him, I know he's quite slim. Okay, so this is a herniated disc, and it's going on 10 years. I'm happy with 70% improvement. And tomorrow we'll do some more over the course of the evening. It'll soften, it'll loosen up, you'll get more effect. I'd often tell my clients, you know, the needles are directing your body to stop the pain, to heal that herniated disc. So I'm totally cool if this was in my clinic. I'm happy with that result. And tomorrow we'll do another session, maybe we'll do naval acupuncture to reinforce that. So we talked about expectation earlier.